All right, thank you for staying with the Monday Report. Town Hall session begins right now. We're about to have a very important conversation. I say it's important because there's an increase. According to the World Health Organization, COVID-19 has increased anxiety and depression by 25% worldwide. How is the situation in Kenya? Is there a remedy? That is what we're going to ask our experts in studio. This conversation is brought to you and sponsored by the European Union, Aga Khan Foundation, and the Aga Khan University Hospital. Thank you so much for making time for us. Dr. Angela Migowa is here, pediatric rheumatologist at the Aga Khan University Hospital. Thank you so much for making time. And Dr. Catherine Gitao, consultant psychiatrist and section head of psychiatry at the Aga Khan University Hospital. Asante sana for making time. And Dr. Gitao, I'll start with you on this. So WHO says 25% increase in anxiety and depression worldwide.
Yes. How
is Kenya faring? Are we worse off? Are we still within the same radar? What have you seen as a practicing psychiatrist yourself?
Okay. First, I'll say thank you for having me this evening. In terms of the numbers, mental health cases, in terms of mental illnesses, have increased greatly since COVID-19 pandemic. So, for instance, in my clinic, I've seen quite a number of cases where anxiety, someone says that around the time COVID hit, that's when I noticed I developed panic attacks, So there is definitely an increase in terms of anxiety, depression, and substance abuse, which has really increased greatly in our setup. And then during the pandemic also, we had about increase in gender-based violence, all manner, which also shows that definitely there are quite a number of mental health issues also going on there. Increase in things like, I've talked about substance abuse, gambling, and quite a number of other addictions that have been increasing over time, as well as suicide, self-harm. You find, especially the youth, I find that during the pandemic, I think due to the time that they had in their hands, there was a whole year without schooling. There was more use of substances, and with that also now we are seeing more of the mental health issues arising from now the substance use in terms of psychosis, depression, suicide, self-harm. All that now is also on the increase, or has increased as a result of the pandemic.
And what is causing all this? Is it the disease itself or the after effects of the disease? So say, for example, somebody lost their job during COVID-19, so it's not so much the disease itself, or is it the actual disease that's causing all this?
Quite a number of things happened with COVID. As you've talked about, many people lost jobs, livelihoods, and that being a major factor or stressor, we would say, will also affect your mental health. Let me just say that it is a direct effect in terms of, I've lost my livelihood, then what? It's a major stressor. And by the time I find my balance and I'm able to, now start thinking beyond, this loss, during that time there's a lot of pressure, a lot of stress, and the stress itself can be a trigger for mental illness. So the manifestations are different. Some people will be more likely to develop anxiety, others depression. So the manifestations that we see thereafter, I think, are quite different. I wouldn't say that maybe the mental illness, but also those who develop mental illnesses as well, they'll not perform as well in their workplace. So in terms of their output at work, it will reduce, and that in itself can also make you more likely to lose your job. So there's a lot of elements there, and of course now people lost loved ones. So due to those losses, the illness itself, the fear of the illness, all those were all triggers towards now leading to mental illness.
So it's almost like a vicious circle we're dealing with.
Yes.
And Dr. Migowa, how does this manifest in children? It's a department, it's a group that many people don't talk about much. But how did it manifest in children?
So, thanks to the Citizen team for hosting us, and to our colleagues celebrating the Feast of Lights today. Happy Diwali. For children, a lot also depends on the developmental stage of the child. Because sometimes you'll find like the toddler group, for example, would behave like in an unruly or uncontrollable fashion, for example. Then you would have like the teenagers, they might withdraw, you know. So you find a teenager who was very active, involved in sports, all of a sudden withdraws, you know. Or their school performance is beginning to deteriorate. So as opposed to just labeling a child as being, oh, naughty, not paying attention, I think we owe it to them as the guardians and adults to probe more and find out, you know, why has your school performance dropped, for example, you know? Then there's something we call, you know, the activities of daily living, you know, that includes grooming yourself, you know, your sleep pattern, your eating habits, you know. Those are some of the subtle things that might change in children, which you could easily ignore or gloss over, but it's actually a red flag. It's a red flag that something is not right. And you know, as per the UNICEF report of 2021, looking at the global situation of the child, they found that about 50% of our children are battling with anxiety, are battling with depression, and are battling with post-traumatic stress disorder. And I think it's important for the adults watching this show today to remember that children watch us, you know. As my colleague has highlighted, the loss of routine, that comes, you know, with school, you know, the fact that families, their earnings dropped, you know, children are cognizant of this. Because of the loss of routine, not going to school, and we saw it in some of the media reports, some of the ills or, you know, very nasty things that were happening to our children just because they're out of that safe zone of school, you know. So children are not exempted from some of the mental health issues that we commonly see with adults. They also are susceptible to some of these conditions.
So a parent who's watching you right now, Dr. Migoa, is wondering, so what should I look out for in a child? You said the changes in sleep pattern, also PTSD, but how does it show? Is it does the child become a bit more angry? What do they look at? And how do they address it? Because sometimes children can be very straightforward when you speak to them. So they tell you, Mom or Dad, I want to go back to school.
Correct.
But school is closed. So how do you explain this to the child to understand that this situation is a passing cloud? So what do you look out for and how do you address it with the child?
So one of the things I tell even parents in my clinic, if you as a parent, deep down in your conscience, you feel something is not right with my child, don't ignore that. Don't ignore it. That instinct is very powerful. That parental instinct is very powerful. Of all the things I'll say today, don't ignore that. Now, the other thing is you can look at it in 4 domains. Because as a human person, you have the physical domain, the emotional domain, the cognitive domain, you know, things to do with the mind, and the social domain. So when it comes to the physical domain, like I said, remember, children from different ages, the different things we expect of them. So from the physical domain, you're looking to see, has the sleep pattern of my child changed? Has the eating habits of my child changed? For young children, you say play is their most important work. That's their job. Children play. So you want to find out, you know, the physical activity I expect of my child, whether they're a toddler or they're 10 years old or they're teenagers, has that changed? And you're looking for excesses, either excesses or the extreme end of it's reduced. Okay, that's the physical domain. Then again, you have the emotional domain. Are they having these outbursts that are unexplainable? You know, or things that would normally make them happy, like maybe a certain cartoon or taking them out, I don't know, for pizza. Now, are they no longer interested? You know, that's the emotional domain. Then the cognitive domain, And this is where we really have to be vigilant, yeah? Because there's a lot of things that are being fed into our children and we are not aware of it. So we need to be alert and see, what are they reading? You know, what kind of music are they listening to? You know, I came across some young teenagers who told me for them, they view suicide as being heroic. And they were showing me certain things on social media posts justifying that suicide is heroic. So we need to be vigilant and see what is being fed into the minds of our children.
Yeah.
And then ultimately I say the social domain. What kind of friends are they keeping? What kind of company are they keeping? Most of the times, if we analyze our children in these 4 domains, you will often pick that something is not right.
Yeah.
Yeah. Okay. And that's the time to reach out for help,
yeah,
to see how we can support them to overcome this.
And Dr. Gitau, how does it manifest in adults? Because some of them are very good at keeping things. And in fact, most of them, if you ask an adult how come they've changed, you're like, something is wrong, Dr. Gitau, they'll always say, no, it's a passing phase. My boss shouted at me today, I'm just not in the mood.
Yeah.
Is there a cut-off point that you know, all right, now this has gone on for too long, now we're dealing with something to do with mental illness, and at what point do you then say this is just a passing cloud?
Okay. So I'll probably answer that question by first talking about mental health, how we'll define mental health according to WHO, in the sense that mental health is a state of mental well-being where you're able to cope with the stressors, the day-to-day stressors. You're able to be productive in terms of at work. If it is an adult, you're productive as a student. You're able to, learn well. Socially, you're also contributing and interacting well with your peers and, the people at your workplace. And in essence, you're able to contribute to the community positively. So when you're having a mental illness, then these are areas that will be affected in the sense that if it is coping with day-to-day stresses, somebody is not able to cope. And you can see that you'll hear someone say they're feeling overwhelmed, they don't know how to move beyond, this point. Some might get to a point where they're feeling hopeless or worthless, and they're not really able to handle the day-to-day stresses. When it comes to occupationally, when they go to work, they're not as productive as I had mentioned before. So they're finding that probably their concentration is not good. If it is their deadlines, they're not being able to meet their deadlines. So there are issues that they're able to pick at home when there's probably somebody who was able to cook and prepare meals for their family and take care of house chores, very well. And now they're seeing that they're lagging behind. They're not able to really catch up, and it's a struggle to get up every morning and get something done. So in terms of mental health, it affects different areas So it can affect you occupationally, socially, and in different other aspects. So for some people, we say they're high functional in the sense that they can be having depression, but they're still able to go to work, be productive, and, seem like they have it all together. But such an individual, when you ask them about their emotions, how are they feeling, then you will realize that they have an issue. In terms of how are they, in terms of feeling happiness, joy. Joy is something that in terms of well-being, when you're talking about our well-being, you're talking about being happy. Being able to enjoy your day-to-day activities. They're not able to enjoy that, and they could do that before. If it is hobbies, they are not interested anymore. If it is interacting with people at home, they'd rather isolate themselves and, don't really want to mix with others. So there are different manifestations, and we say that at those different levels, it's important, once you see that there is a problem, to accept that there is a problem. That's why we start with acceptance. When your friend is not accepting that there is a problem, just bring it out gently in terms of, you could do this before, what's happening now, can I get you a professional to help? And again, don't forget that with mental illnesses, there's a lot of stigma. So no one really wants to be told that they are you know, it can be difficult for some people to accept, yeah, because of the stigma that comes with it. So just reassuring them and, you know, being there for them, I think is most important. And also just trying to help them to readjust or to deal with the problems that they're facing at that point in time. Because if you're a friend, then you'll really know what's going on, and helping them problem solve where probably you know what the problem is, getting them to feel connected and be supported. I think that is what is most important.
In your experience, is this more common in men or women? And how do they deal with it, the genders? The men deal with it, and how do the women deal with it?
I'll just say that men and women are both affected by mental illnesses, just a manifestation of it that can be different. In terms of, for most men, when they have like depression, anxiety, they'll tend to use substances. So mostly what you will see is a substance use or abuse, as opposed to women who it will be, the manifestation will be more of the symptoms of depression or anxiety. And when we're talking about symptoms of depression, we are talking of a consistent or persistent low mood that has been there for, you know, more than 2 weeks, and this person has lost what we say pleasure in doing most activities. Their motivation is quite low. They feel hopeless, worthless, and such kind of, it's a cluster of symptoms, basically. Then when it comes to anxiety, then you find that this person is worrying a lot, always on edge, feeling like things are going to go wrong. And I know sometimes anxiety disorder can be confused with, you know, normal anxiety. We all feel anxious every now and then. But with the anxiety disorders, it's going to affect how you interact, you know, with your environment, either socially, occupationally. It's going to affect you in those areas.
And Dr. Migoa, let me bring you back on this. So, truth is, COVID-19 did break some families. And in fact, most of the families underwent a lot of stress during that time, including the gender violence that Dr. Gitau was talking about. How do you address this with a child? Do you tell them the bare-knuckle truth, or what do you do? And if the parent, him or herself, is already depressed, how do they tell that the child is depressed? Because, like you said, the child is a mirror image of the parents, but sometimes the parents themselves don't even know that they're stressed. But do you then tell them the truth? Mommy or daddy left because of this and that? Or how do you handle it when the questions start coming? Because most of the parents will push the children away because they don't want to address it. How do you address it in a way that the child understands? Or do you seek help from a counselor?
You know, Trevor and my colleague Dr. Gitau here can emphasize it. Behavior is driven by intention. So the million-dollar question is, when you're telling this child that you as a parent have this mental health disorder, or as the child, you're noticing that the child has a mental health disorder, the million-dollar question is, what is your intention when you're telling them? Because your intention for telling them will govern how you tell them, the environment in which you will tell them, and you will offer options on the way forward. But in summary, it would be important to lay the cards on the table. Because sometimes as adults, we feel that children don't need to know. Or
protect them from the world.
Exactly. But the reality is, it's not a perfect world. And an example I'll give, which also ties in with COVID, for example, is we know that there were deaths in families, right? And we grieve as adults, and we forget that children also grieve, you know? So I've had a couple of children, for example, who come with, because I treat children with arthritis, they have aches and pains all over their joints. But when you examine this child, they are actually okay physically. Right?
The joints are perfect.
The joints are perfect physically. But pain is a very interesting symptom because it doesn't have not only a physical component, but it has an emotional component, psychological component, and even an add-on, a spiritual component.
Yeah.
You know, and sometimes the parents come and they insist, you know, there's a problem, let's do an MRI, let's do a CT scan, but the problem is not physical. So I think it will be important to often lay the cards on the table, and depending on the nature of your child, because parents, guardians know their children, right? It will help you craft the environment in which to say it. Maybe you might need to bring a close auntie they feel comfortable with, or maybe the pastor at church, you know, whom they feel comfortable with, so that you're able to tell them that this is what has happened, this is what I'm going through, or this is what we notice in you. And don't just leave it at saying that there's a problem. What is the solution that we offer moving forward? So as a parent, you'd say that for that reason, I'll be seeing a doctor to help me. Or for this reason, we propose. That's the other thing about children of this age. It's not easy just to tell them, we're going to do this.
You don't lay down the law.
Yes. You know, there's a generation where you have to actually, you know, this is what we are proposing. What do you think? And that's really the technique of what we call motivational interviewing. You as the parent, you still have your way. But the tactic that you use is what is different. I think in a nutshell, that's what I would say.
And Dr. Gitau, this interesting perspective of how the adults deal with it. And you mentioned about 14 days, about 2 weeks. If a certain situation stays and is maintained, then you know there's something wrong. But there are two aspects to this. So first, there's the self-diagnosis. As a person, how would I know that there's something off about me? And how do I address it? But then there's the people from outside. And some of them will go to the extremes that you're talking about, suicide and all that. And you hear the friends say, we never saw it coming. They were the party, they were the life of the party. They were always happy. So how then would you know that a friend is going through something if all these symptoms you're talking about are simply not there? They keep a front anytime that they're with you.
That's a good question. Yes, there are those who will even come and see me in my clinic and tell me, when I'm leaving my house, I say it's showtime, you know, like I'm going to put on a face for people and, you know, and act very happy and all that. But always, there will always be a sign. If you're keen and if this is your friend, there is always a sign. And most of the time you'll find that this is a person who has somehow either retreated over the weeks or over the months and they are not really themselves to some extent. There will always be something that you will see, because, for example, if someone, you know, someone tries to put on a brave face always, like at work, probably they'll mess up a bit, you know, you'll find that they're forgetting or they're not focusing so well. Much as they're trying to put on this face, there'll always be either at work, in their social life, or somewhere along the way, there'll be something that you'll see is off. And it's always good when you see your friend has something going on. Just approach them in a caring way. You know, so how you approach the person really matters. And for some people, they'll say they don't want to share because then people don't really care, you know. So as you're also asking, are you asking to really know what is going on and to support them through it? Because then sometimes friends might ask you what's going on, and then sound judgmental in that now they tell you, just get over it, you know, you know, this is something so small, you know. So if you're going to minimize, if I have come to you before and you minimize my problem, I will probably not come again and tell you about it. But if you're keen and positive and wanting to really help your friend out, then I'm sure someone will open up and be able to get the help they need in good time.
And as a person?
As
the kind who's looking at myself, I still need to look out for the same issues? Because you see that the natural reaction of a person is to give themselves excuses. I slipped on this one, I didn't feel like doing it, I was tired, my boss was too much, things like that. So how would you know that this is getting out of hand as an individual? self-diagnosis.
Yes, self-awareness.
Yes.
I think we start there. As a person, then if you're always falling back in terms of you're not being able to meet your deadlines, therefore there is a problem. Then if maybe emotionally, you're also finding yourself, you're more irritable than usual, you know, and then in terms of maybe your appetite, you're noticing I'm not eating as much as I used to. I don't enjoy the things I used to enjoy. I don't want anyone to interact with me. Those are already signs that there's something that's not going right. If you're a person who enjoyed, you know, sitting down with your family after a long day and having fun, watching a movie together, and now when you get home, you just want to go to your room.
Yeah.
You know, there's something not right.
Okay.
And if you feel that you're not comfortable talking with family, then that's a point where you now see, even if it's a counselor, find out, I don't know, there's something wrong. You know, some people just come to me and tell me, I know there's something wrong with me.
But I don't know what it is.
I don't know what it is.
Yeah.
Just tell me what's going on,
Okay.
you know? And then we go through the symptoms. What have you been feeling, you know? What has been going on psychologically, emotionally? What have you noticed is different? And then we start the conversation from there. So I think also just seeing the health professionals, the mental health professionals to assist. When you know there's something wrong and you really can't put a finger on it, I think that's a good place to start.
All right.
Yeah.
Let's take a quick break here. We're talking about mental health and COVID-19. It's a very important conversation. We'd like to hear from you as well at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. I see some of your questions here. Lance Senior, Mutai, see Engineer Lazaro. We'll pose some of those questions to the experts here in studio. See you shortly.